So we're very happy to introduce to you Dr. Massimo Orioles. He's a specialist in, as it says, in the farming and of aquaculture species, and also in the products thereof. So you will be talking about a very recent innovation or research you have been done on trout. So the floor is yours.
Thanks. Thanks for the introduction. I said my name is Massimo Orioles. Good afternoon, everyone. And I currently work as a researcher, just finished the PhD at the University of Udine. I'm going to talk about red mark syndrome in rainbow trouts and presenting advances in diagnostics and possible management strategies. The output of my PhD project has been performed in collaboration between Udine University and DTU Aqua in Denmark. So red mark syndrome is a non-lethal skin disorder affecting predominantly rainbow trouts, has a worldwide distribution, and has been thoroughly described for the first time in late 2003 in UK. Since then has rapidly spread across Europe, involving main countries producing trouts, of course, and is characterized by very nasty skin lesions, hemorrhagic, raised on flank of fish. This disease causes no mortality. It's quite peculiar because it does not affect growth rate, feeding conversion rate, but does cause economical losses. And these have been estimated more than 5% in some studies, 5% of production cost, of course. Currently there's no etiology confirmed, so the causative agent has not been determined. So the diagnosis still heavily relies on predominantly clinical features and histopathological characteristics. Many studies have considered the role of an intracellular bacteria called a midi-chloria-like organism that might be involved in this disease. The disease, by the way, is responsive to antibiotics, okay, and has a spontaneous resolution. Our research has been focused on establishing the effect of water temperature on the development of red mark syndrome. We proved, thanks to our experimental model, that a milder severity and quicker healing is seen with higher temperature above 15.5 degrees. And we established a strong association between red mark syndrome and the midi-chloria-like organism. For the first time in an experimental setting, we were able to visualize midi-chloria-like organism inside skin lesions by using electron microscopy. And furthermore, we developed and applied a novel diagnostic technique, which is called digital droplet PCR, very sensitive when compared to standard molecular biology, qPCR, quantitative PCR, and very specific to detect midi-chloria-like organism DNA. We believe that the output of our research can be beneficial for the whole trout sector, especially for portion table trout producers and organic trout farmers, because especially for these producers, we don't have, there is a lack of management strategies, basically. So antibiotics are not an option. Grading out and holding back the fish is not an option as well. And what we propose through our output is an alternative way. You recognize, so the etiology, the causative agent of red mark syndrome, and use the sensitive technique that we developed to reach an early detection of the disease. Through the use of digital droplet PCR, which is the molecular biology technique we developed, we would be able, we think, to extract the midi-chloria-like organism DNA from the environment, so from water sources, for example, from sediment. And what we would like to do in the future research is to estimate the pathogen abundance. In this way, we think we could actually give an alternative to farmers, quantify the disease risk, predict red mark syndrome outbreak, and we would like to transfer this type of information to farmers to implement biosecurity and management strategies. Thank you very much for your attention, and of course, thanks for this opportunity.
Thank you very much. So as a user also, as you said, you had your experiment done at the DTU Aqua, so
Yes.
that was through the AQUAEXCEL project. So if anybody is interested to also do experiments that they can't do maybe at their own university, there is this opportunity where you can get some funding from the European Commission and get your experiments funded there. So thank you very much. I don't know if there's any direct question to Massimo. Yes, please. We will have a panel discussion afterwards, but maybe there are some clarifications you want to...
Management procedures and can be permitted.
Yeah, what we would like to do is to repeat some experiences that we basically studied in literature, creating some predicting index, analyzing, quantifying midichlorian-like organism DNA and water parameters as well, combining this type of informations and creating some predicting index to be able to tell the farmers when it's time for the outbreak. Maybe the farmers could try to understand whether it's time to sell the fish a little bit earlier, to treat preventively if it's the case, or to wait and find other channels, commercial channels. For example, just to give you an example, in UK, anglers, fish sold for anglers are a very good value. The disease has a spontaneous resolution, so maybe the farmer can find alternative channels to sell the fish as well. But I think all this information might give alternatives to what is happening right now, which is only wait and see.